So right now see the first ID procedure. Sometimes accidents happen in the laboratory, example burning, shocks, poisoning. When it happens, we need to know what to do to help. By starting with suffocation. Suffocation is when your lungs do not get enough air, making it hard to breathe. So, you can check breathing by treating their head back, look and feel for breath. Give 5 secure breaths, treat their head back, pinch their nose and seal your mouth over their mouth. Blow 5 times into the child. Give 30 chest compression, push film in the middle of their chest with one hand. Give 2 secure breaths, continue with 30 chest compression and 2 secure breaths until help arrives. Now let's see the procedure for suffocation. Step number 1. Remove what causing the problem or remove the person away from it. Step number 2. Make sure the airway is clear. Tilt their head back gently to help them breathe. Step number 3. Give them air by blowing into their mouth through a clean cloth or paper. Don't use your mouth directly to avoid spreading germs. Step 4. Keep them warm with a light blanket. Lastly but not least, step 5. Get them to a doctor or a hospital as soon as you can. Another thing is fainting. Fainting is when someone suddenly falls down. Also, sometimes people can suddenly lose consciousness and faint. It happens when their brain does not get enough blood and oxygen. So let's now see the procedures for fainting. First procedure, first lose or step number 2. Lay the person down on their back. Step number 3. Lift their legs to help more blood flow to their brain. Step number 4. Make sure they are in an open area with lots of fresh air. Step number 5. If they don't wake up after a few minutes, take them to a doctor or hospital. Again, we have burns. Burn is dealing with heat and chemical injuries. So, when you want to give the first aid to the person who burns, you must follow these steps. Start cooling the bunny as quick as possible. Run it under the cool water for at least 10 minutes. Remove any juice or clothing near the burn unless it is stuck to it. Don't use ice, gels or ice creams. They can damage tissues and increase risk of infection. 10 minutes later, cover the bun with kitchen plastic bag. This will protect it from infections. Watch for signs of shock. So now let's see the procedures for buns. First procedure, lay the person down and try to keep the burnt area away from the ground. Number 2, pour cool water on the bun for the 10 minutes. This is help to reduce pain. If it is a severe burn, call the medical help right away. Number 3, check if the person is breathing and has a pulse. Be ready to give them air if needed. Number 4, gently take off any jewels, shoes, or burnt clothing, but do not remove clothes sticking to the skin. Number 5, cover the bun with a clean gauze bandage to protect it and reduce pain. Number 6, give them something for the pain. Number 7, take the person to a doctor or hospital. The important thing to remember is do not use ice on the bun. It can make it worse. Another important thing is to avoid putting ointment or butter on the bun because it won't help it heal. Again, do not pop any blisters. It can lead to infections. Also, you can note that burns on the face, mouth, or throat are serious. They can make it hard to breathe. If that happens, get medical help right away. Another one is choking. Choking is when something gets stuck into your throat. As we see here, you can stand behind, encourage quote, laying them forward, support the upper chest, give sharp back blows between shoulders, breathers, give 5 back blows, check the mouth, and remove obstructions. If unsuccessful, give 5 abdominal thrusts, stand behind casual, press both arms around, laying them forward, pull sharply in and up, 5 thrusts at the time. If unsuccessful, repeat the cycle, 5 back blows and 5 abdominal thrusts. If not clear after 3 cycles, call for an ambulance. Now let us see the procedures for choking. First, try to cut it out. Encourage the person to cut and see if what helps them to get the object out. So, if cutting does not work, Give gentle taps between the shoulder blades to see if that helps dislodge the object. The hemorrhage maneuver. If the object is still stuck, you can try something called the hemorrhage maneuver. Stand behind the person and put your arms around them. Make a fist with one hand and put it just above the stomach. Use your other hand to hold your fist and give quick upward pushes to help force the object out. Keep doing this until the object comes out. And final, get the person to a doctor or hospital just to make sure they are okay.